Please watch the entire operating instructions video prior to testing. The test is intended for individuals aged 14 years and older who self-collect anterior nasal swab specimens directly or with adult-collected anterior nasal samples directly from individuals aged 2 years or older. Please read the package insert before performing the test. This product has not been FDA cleared or approved, but has been authorized by the FDA under an EUA. This product has been authorized only for the detection of proteins from SARS-CoV-2, not for any other viruses or pathogens. And this product is only authorized for the duration of the declaration that circumstances exist justifying the authorization of emergency use of in vitro diagnostics for the detection and/or diagnosis of COVID-19 under Section 564b1 of the Federal Food, Drug, and Cosmetic Act, 21 U.S.C. 360 BBB 3b1, unless the declaration is terminated or authorization is revoked sooner. Wash or sanitize your hands. Make sure they are dry before starting the test. Carefully read the instructions before performing the test. Failure to follow the instructions may result in inaccurate test results. Take out the test cassette and place it on a clean, flat surface. Remove the aluminum foil from the top of the extraction buffer tube and place the extraction buffer tube in the perforation located on the box. Open the swab packaging at the stick end, not the swab end. Do not touch the swab head. Gently insert the entire absorbent tip of the swab head into one nostril, 1/2 to 3/4 of an inch. Firmly rub the swab in a circular motion around the inside wall of the nostril 5 times. Take approximately 15 seconds to collect the specimen. Be sure to collect any nasal drainage that may be present onto the swab. Repeat this in the other nostril. Note: a false negative result may occur if the nasal swab specimen is not properly collected. Remove the swab from the nostril and immediately place into the extraction buffer tube. Note: test samples immediately after collection and no more than 1 hour after the swab is added to the reagent solution if stored at room temperature. Immediately place the swab into the tube and swirl for 30 seconds. Note: a false negative result may occur if the swab is not swirled at least 30 seconds. Rotate the swab 5 times while squeezing the tube. A false negative result may occur if the swab is not rotated 5 times. Remove the swab while squeezing the tube. Dispose the swab in the trash. Attach the dropper tip firmly onto the tube. Mix thoroughly by swirling or flicking the bottom of the tube. Gently squeeze the tube and dispense 4 drops of the solution into the sample well marked S and not the well with C and T. Note: a false negative or invalid result may occur if less than 4 drops of fluid are added to the sample well. Set the timer for 15 minutes. Results should be read at 15 minutes. Do not read after 30 minutes. Note: a false negative or false positive result may occur if the test result is read before 15 minutes or after 30 minutes. Both the control line, C, and test line, T, appears. This means that SARS-CoV-2 antigen was detected. Note: any faint line in the test line region, T, should be considered positive. A positive test result means that antigens from COVID-19 were detected, and it is very likely you currently have COVID-19 disease. Self-isolate and consult your healthcare provider as soon as possible. Your healthcare provider will work with you to determine how best to care for you. If only the control line C and no test line T appears, then this means that no SARS-CoV-2 antigen was detected. A negative test result indicates no antigens for COVID-19 were detected. If you test negative and continue to experience symptoms or symptoms become more severe, please consult your healthcare provider. If you do not have symptoms, you should test again in 24 hours, but not more than 48 hours. It is important that you work with your healthcare provider to help you understand the next steps you should take. It is possible for this test to give a negative result that is incorrect, false negative, in some people with COVID-19. This means you could possibly still have COVID-19 even though the test is negative. A negative result does not rule out COVID-19. There is a higher chance of false negative results with antigen tests than with laboratory-based molecular tests. If the control line C fails to appear, review the instructions again and repeat the test with a new test kit and a newly collected specimen. If the problem persists, call 800-838-9502 for assistance. Carefully read the instructions before performing the test. Failure to follow the instructions may result in inaccurate test results. Individuals should provide all results obtained with this product to their healthcare provider for public health reporting.